What is life if you aren't able to thoroughly live it? Health is the core of a vibrant life. It takes a team to ensure a community is healthy enough to achieve its dreams. A family of professionals working together, caring for you and your loved ones. At the UNT Health Science Center, we create solutions for a healthier community. In addition to training first-class physicians, scientists, and public health professionals, we provide solutions that allow people to receive care even when there is a shortage of doctors, and solutions that ensure we can walk, move, reach, and grasp a better quality of life. These invaluable contributors to our well-being include physician assistants and physical therapists who learn to protect our health in our School of Health Professions.
The physician assistant and physical therapy professions really are off the chart. They are on the top 10 list of almost any list of the most desirable professions, let alone health professions in the country. So that makes us feel good. We know we're really doing the right thing and meeting a great need in healthcare. Both of these programs we know benefit the community. Health profession students tend to stay in practice where they train. So our graduates, many of them, will stay in the Fort Worth community where they will serve and take care of Fort Worthians and their families.
The first physician assistants were former hospital corpsmen in the Vietnam War who received additional training to address a physician shortage in the 1960s. The Physician Assistant Program's founding chairman is a military veteran and former head of the U.S. Air Force PA training program.
A physician assistant is an individual who's licensed to practice medicine, working with the supervision of a physician. What we do is practice medicine. How we do that is through the delegated authority of the physician. We are able to examine patients, take histories, make working diagnoses, prescribe medications, counsel patients, different things that you might normally expect a physician to do. A physician assistant can also do that, but they do that in partnership with the physician. We are also able to reach into underserved communities and rural communities and areas where there may be physician shortages. When I became a PA, it gave me the chance to work with patients and to become involved in their healthcare delivery. The rewarding part is what that does and what you can see how your involvement in their care makes a difference. When you can convince a patient how important it is for them to stop smoking or how important it is for them to take their medications and they get better, it's extremely rewarding. The number one thing that we need to do as a PA program is we need to continue to graduate the quality graduates that we are producing now. Those physician assistants, when they graduate, are going out into the community and providing top-notch health care to our patients.
Assistant Professor Kirk Barron was named Educator of the Year for the Texas Academy of Physician Assistants.
As we're teaching students, we're always getting more back in terms of what we're learning. And you're constantly learning. The students are always giving you additional feedback, asking new questions, asking questions in different ways. I love that part of the teaching aspect.
Physician assistants practice family medicine or in specialties like cardiology or surgery.
I'm now in the emergency room, and I'm also now working at a critical care hospital to boost my critical care skills up. So the versatility of the profession itself and helping people.
Alumnus Monty Morris owns a rural practice in Justin, Texas.
I consider the strengths of the UNT Health Science Center program to be things like the bonding between students and faculty, outstanding facilities. It's tremendous what you get out and are able to do. Going from any specialty to family practice to a rural health clinic like we do here, it just gives you an incredible sense of ability that your education has pushed you to the point that you can go into anything.
Our PA program is a 34-month master's degree level program that provides students with more clinical experience than most other programs. Siobhan Echetabu is completing a clinical rotation in dermatology.
As a licensed healthcare provider, we were able to express autonomy under the supervision of a physician by making medical decisions and being able to treat and diagnose patients. We have a low drop rate within the classes and a high first-time board exam pass rate, which I felt like as a student was important to me when making a decision upon which school to go to.
Those are many of the reasons students continue to choose not only our nationally ranked physician assistant program, but also its new physical therapy program. Both offer attentive faculty and provide first-year students a second-year mentor or big buddy to help them succeed.
That's the good thing about the faculty here is they're not trying to, to make us drop out of the program or anything. They want us to succeed.
We get to use the DO simulation lab, which we used the other day, with a patient that has lines and trach tubing, so it's really state-of-the-art.
A big thing for me, I think, is the support. Not only of the faculty, but of your big buddy. I don't know. I just felt like I could succeed because I had all these people helping me out.
Really, it's a team effort.
Yeah, I definitely got a sense of that right when I walked on campus for my interview.
Yeah.
I was like, this place is awesome.
Yes.
The physical therapy students in this group will be practicing a profession that originated to care for injured soldiers and polio victims. The Health Science Center's new physical therapy program educates students in all aspects of contemporary physical therapy and the option of enrolling in a special rural track that prepares them for practicing in small communities. This doctoral level program is the second that Chairman Clayton Holmes has developed.
The scope of physical therapy includes everything from pediatrics through geriatrics. Society is trending toward physical therapy. Many people as they age will need physical therapy. Also an increased emphasis on health and wellness. Physical therapists are often involved in that aspect of healthcare. The need for physical therapists is growing fairly dramatically. I couldn't imagine having been part of a profession that has blessed me more. It's just an extremely rewarding profession, primarily because of the patient-therapist relationship that develops because of the time we spend with them.
The physical therapy program is moving the profession forward through such leading-edge technology as this virtual reality research into gait and balance, conducted at only 5 institutions in the world.
It is important to do research in physical therapy because research provides clinicians with the scientific evidence that guides their clinical practice. Our laboratory is taking a creative approach using virtual reality technology to investigate balance and movement impairments and help various patients regain their functional independence. Results from our research studies are translated into better interventions for fall preventions in older adults, improvements in rehabilitation protocols for patients with diabetes, stroke.
Many PT faculty treat patients in the UNT Health's Patient Care Center.
We've drawn people from literally all over the globe, colleagues from Romania, from Egypt, and myself from New Jersey. We've covered the country pretty well and the world and have brought all of our different expertise to best impart our knowledge of our profession to the next generation of practitioners. I get to spend an inordinate amount of time with an individual, really get to develop a great rapport and get to help facilitate their recovery. Is just one of the greatest gifts.
UNTHSC's physical therapy program is developing a solid reputation.
I really like how they rounded out their program, but they've really done a good job of bringing in a very eclectic group of professors, and I think it's a very strong program. They've got a really great faculty. The chairman is so pro-student, and he really wants these students to get it. He's doing everything that he can to help make this the best program.
Our graduates have a stellar reputation in the professional world.
Well, certainly the technical aspects of their training is superb. What I think is really a benefit to our practice and to our patients is the ability that they have to really connect with the patients, to dig deep and really find out what's going on with that patient and make sure that their needs are addressed.
Patients appreciate the care they receive from these graduates. Here is Amy Murphy, one of P.A. Morris's patients.
you're going to get the utmost care and treatment because of his bedside manner, because of his training. I mean, all of those things. You know that he's going to sit down and take the time with you that you truly deserve and that you need.
Graduates of the School of Health Professions provide solutions that contribute to a healthier Fort Worth.